Hi, I'm Dr. Larry Malerba, and this is All Things Homeopathy. Once you learn about the broad scope of homeopathic care, and once you've seen homeopathy in action, it's natural to become critical of mainstream medicine. And much of that criticism is well-deserved. However, when outsiders hear those criticisms, they may get the false impression that homeopathy is anti-conventional medicine. This is simply not true. Any homeopathic practitioner or patient who thinks that homeopathy renders Western medicine obsolete is living in a fantasy land. They're just not being realistic. Of course, the results produced by homeopathy can be both inspiring and intoxicating. It can lead newcomers to believe that it should be able to serve all their medical needs. And while homeopathy can be of great benefit in almost all situations, we must also acknowledge that we live in the real world. And in that world, people occasionally need mainstream medicine too. Any homeopathic devotee who rejects all of allopathic medicine is guilty of fanaticism. But make no mistake, such fanatics are far fewer in number compared to the growing number of allopathic fanatics who reject homeopathy and other forms of holistic healing even when they know nothing about them. An ideal medical system should always be on the lookout for what's best for its patients. Western medicine's most obvious strengths are diagnostics, surgical procedures, and emergency medicine. One of its greatest achievements is insulin, which has saved countless lives. Its biggest weakness by far is its poor track record when it comes to treating chronic illness. In fact, suppressive drug therapies and vaccines are arguably the two factors most responsible for the alarming rise in chronic disease. Fortunately, homeopathy's greatest strength is its track record when it comes to treating chronic illness. Nothing compares to homeopathy's ability to reverse chronic disease. Combining the inherent strengths of all healing modalities would produce a formidable medical system. It's the primary theme that runs throughout my book, Green Medicine. Unfortunately, mainstream medicine is a closed system. It's become virtually impervious to new ideas. Medical schools indoctrinate students into a rigid system of dogmatic medical thinking, which is disguised and promoted as state-of-the-art science. Medical students are discouraged from thinking for themselves and are taught that there's a pharmaceutical solution for almost all problems. True science should not only be receptive to new ideas, it should enthusiastically embrace the prospect of innovations that could advance its knowledge. Scientism is science's evil twin. Scientism is fundamentalist science. Science that is so certain of itself that it no longer sees the need to question its own assumptions. This is a complex topic, one that I will return to in a future episode. But for now, I will simply state that modern medical science is beginning to resemble a form of scientism. It has essentially been hijacked by pharma. One of the main functions of Western medical science has become to provide justification and cover for the use of many dangerous drugs. Drugs that few would ever take if they knew there were safer, more effective options available to them. So yes, homeopathic devotees are rightly critical of conventional medicine. But it's important not to throw the baby out with the bathwater. All medical and healing modalities have their strengths and weaknesses. Unfortunately, medical groupthink is a powerful force to be reckoned with. Mainstream medicine is compromised by a type of bias that prevents it from being able to work in a collegial manner with those who represent other schools of medical thought. Although there are always exceptions to the rule, many mainstream practitioners have taken an antagonistic stance toward holistic healing. Instead of approaching new ideas with curiosity, as any open-minded person would, they're taught by medical authorities to demand proof according to their own conventional scientific standards. Standards that are infected by the biases created by pharma. When that unreasonable demand for proof is not met, they arrogantly dismiss new ideas as unscientific. As a consequence, I often find myself in the position of having to act as an intermediary for my patients. I inform them of the potential hazards of medicine, and I also let them know when they need the medical system. Not infrequently, it is advisable to consult a conventional medical practitioner. Most homeopaths that I know are remarkably open to new and innovative ideas. They tend to be ethical and perceptive people. They are rightly critical of a medical system that has the potential to cause great harm. And they are understandably critical of any closed system that refuses to consider legitimate alternatives that could benefit its patients. So until the day comes when mainstream medicine makes that decision to be more open and inclusive, those who stand on the outside will justifiably continue to criticize its flaws, while at the same time embracing the good that it does. So no, homeopathy is not out to eliminate mainstream medicine, nor is it opposed to taking advantage of the benefits that conventional medicine offers. Unfortunately, the same cannot be said about orthodox medicine's intentions toward homeopathy. In an ideal world, a truly green healthcare system will someday embrace the best of all medical worlds. Until then, I will continue to fight for what I believe is best for my patients. Thanks for listening. I invite you to subscribe to the All Things Homeopathy YouTube channel at the end of this video. And please tune in again to the next episode of All Things Homeopathy.